Hi, my name is Tori and I am a doctor of physical therapy who specializes in pelvic dysfunction, which means I treat things that can go wrong around the pelvis, and this includes sexual dysfunction. If you haven't, please be sure to check out the very first video in this series, as it speaks more to what is considered normal and abnormal around female libido, and it also talks more about my intention behind this series, which is in summary to walk you through how I would approach low sex drive as a patient who is also a pelvic health provider. So today we will be discussing how your physical body can relate to your sex drive. We'll break down the aspects of the physical body that can affect libido into three categories: non-sexual disease, sexual dysfunction, and surgery. But we're going to focus primarily on non-sexual disease because I think that that could be the trickiest, most difficult category to relate to libido. As always, you can check the description below for timestamps if you want to skip around, and any and all resources or studies mentioned in today's video. Let's begin by talking about non-sexual diseases. Non-sexual diseases like arthritis, cancer, diabetes, heart disease, chronic pain conditions, and neurological conditions can all negatively impact libido. What can feel tricky and overwhelming is identifying if and how that non-sexual disease is affecting your sex drive. And identifying both the if and how are important because once you know if a non-sexual disease is affecting your sex drive and you know how that non-sexual disease is affecting your sex drive, then you can seek the proper treatment. So if it were me, I would first approach that if by establishing a timeline. Establishing a timeline, even a hazy one, can be a really helpful and effective tool, especially if you're managing multiple conditions. How long have you been managing these conditions, and when did you start to notice a change in your libido? The onset of the condition and the onset of the change in your libido do not need to match up perfectly. You're simply looking for a correlation. Once you've identified any correlations, if there are some to identify, the next step is to ask yourself, okay, if this condition is affecting my sex drive, then how is it affecting my sex drive? I would approach identifying that how by applying different levels to my libido. Let me explain. In my eyes, non-sexual disease could affect libido on three different levels: primary, secondary, and tertiary. Primary loss of libido would be a direct result of the disease. For example, a brain injury causes someone to lose interest in sex. Secondary loss of libido would be an indirect result of the disease. For example, arthritis causes someone to have pain when assuming her favorite sexual positions, and over time, her sex drive decreases. Or fibromyalgia causes someone to have extreme fatigue and she's too tired to have sex, and over time, her sex drive decreases. Finally, tertiary loss of libido would be caused by the social, psychological, and/or cultural challenges of having the disease. For example, a chronic pain condition causes someone to develop depression and her sex drive decreases, or a stroke causes someone to be wheelchair bound and that affects her self-esteem and her body image, and that causes her sex drive to decrease. Now, I am fully aware that establishing a timeline, trying to find a correlation, and then exploring these primary, secondary, and tertiary potential losses of sex drive can feel foggy and difficult, and that you might not really be sure of your answer. That's okay. Take your time, turn inward, and try to examine your previous experiences. My best hypothesis is that the majority of people watching would be experiencing secondary and tertiary losses of libido. So assuming you've established a correlation on your timeline, a really fruitful place to begin might be asking yourself, why did I lose interest in sex? Were sexual positions uncomfortable? Was I too distracted? Was I having a hard time focusing on pleasure? Was I feeling sad? Was I too tired? Did I not feel sexy or desirable? Again, take Take your time with this investigation because only you know the answer. I know that sentiment is a double-edged sword because on the one hand, that responsibility can feel heavy, overwhelming, and near impossible. But remember that on the other hand, that makes you incredibly powerful in this situation. Once you identify if and how a non-sexual disease is impacting your libido, it's time to turn to proper treatment. If you're experiencing primary loss of libido, your main focus should be on how you could cure or better manage your disease. If you're experiencing secondary loss of libido, your focus should be on how you can best support your body to allow your libido to improve again. You might want to consider movement specialists like physical therapists, aquatic therapists, yoga and Pilates instructors, or any provider really that can help you learn to better support your body so that you can enjoy sex. I know that this can be an incredibly difficult subject to broach, but as a provider, believe me when I say that clarity in your goals is crucial to effective therapy. Find the strength to tell the provider explicitly what you hope to gain. You can use what we've outlined in the video so far as a sort of guide or a script when speaking with a provider. For example, you might say something like, I noticed that my libido decreased a few months after I was diagnosed with and have been managing arthritis. I think that's because my arthritis limits my ability to feel comfortable in most sexual positions. My goal is to be able to enjoy sex comfortably so that I can restore my libido. Do you think you can help me achieve that goal? If you're experiencing a tertiary loss of libido, then your main focus should be on how you can best support your mental health so that you can improve your libido again. You might consider psychiatrists, psychologists, sex therapists, support groups, really any provider or outlet that can help you better learn to support your mental health so that you can feel worthy and deserving of a vibrant sex life. Because you are. Again, try to tell the provider, any provider that you end up working with, exactly what you hope to gain from the experience. As I've said in previous videos in this series, remember that healthcare is a service industry and that sometimes really well-meaning providers are more concerned with the non-sexual disease itself instead of your sexuality because that's how they've been trained. Try to find the courage to speak up. If you don't feel like you can speak with a provider about your sexuality, let me gently encourage you to seek another provider. You deserve to be able to have that conversation with someone who's giving you care, and don't hesitate to pick your provider's brain about local resources, local providers who are more tailored, more specialized in exactly what it is that you're looking for. Now that we've discussed non-sexual disease and how that can affect libido, I do want to say a few words on sexual dysfunction. While it may be more obvious that sexual dysfunction can negatively impact libido, finding the right treatment for sexual dysfunction can prove to be very difficult. I want to take this time to remind you that if you are struggling with sexual dysfunction, especially painful sex, pelvic physical therapy might be a really helpful tool for you. Whether that painful sex is caused by a pelvic condition like endometriosis or PCOS, or it's caused by a pain condition like vaginismus or vulvodynia, or you're having painful sex postpartum, or you're having painful sex and you're really not sure why. A good pelvic physical therapist would not only be able to tailor interventions to your unique presentation, but should also be a wealth of local information. Pelvic physical therapists try to be as well networked as possible because pelvic conditions require more than just one provider sometimes. So a good pelvic physical therapist will also be able to point you in the right direction of pharmacists who specialize in pelvic conditions, physicians who specialize in pelvic conditions, more holistic providers like chiropractors, naturopaths, herbalists. Just depends on where you live, but a good pelvic PT should also be well networked, and that can be really helpful too. If you live in the United United States, you can use this directory, pelvicrehab.com, to find a provider near you. I'll link to it and other helpful provider directories in the description below. Finally, I do want to end on a note about surgery. If you've recently had any surgical procedures to do with your pelvis or your breasts, or really any part of your body that you associate with your sexuality, the process of healing, the pain of recovery, and the potential shift in the way that you view your body could all affect your libido. Try to give your body the time and space and patience to fully heal. Don't hesitate to seek rehabilitation if you're not healing how you think you should be healing. And if you can, do your best to be honest with yourself and honest with your partner or partners about your relationship with your healing body. On that note, thank you so much for watching. Let me know what you think of this video. I'm approaching this series differently than I've approached other content, and I am very open to your feedback, your suggestions, and your criticism. So if you found this video helpful, please give it a thumbs up, and if you didn't like it, please give it a thumbs down. Feel free to comment anything, questions, content suggestions, feedback, you name it, down below in the comment section. I do try really hard to read and respond to all of my comments. Don't forget to check me out on Instagram. And finally, if you want to, subscribe to the channel for more content, not only about pelvic things like today's video, but also about life things. Thank you again so much for watching. I hope that you have a wonderful rest of your day, and I will see you in the next video. Bye.